Dr. Moffic. I'm a psychiatrist and member of the editorial board of Psychiatric Times. And this is a special video having to do with our upcoming 250th anniversary of the Declaration of Independence, which is called, if I can get this out right, sesquicentennial. I suppose we could say with the July 4th holiday, whether you have 2 days off or 3 days off or 4 years off, it gives a time to reflect on how you're doing personally, including and especially one's work situation. And for psychiatrists and most all physicians, we're still in a stage of almost epidemic rate of burnout that hasn't dropped down significantly in really 25 years now, a little bit up and down, but about the same, which is telling us something about the systems we're in and how they kind of inhibit what we feel we can do to help and heal patients. So the tricky part about this, I think, is that we understand more now another major factor which may be keeping burnout so high. Now, burnout basically has to be reduced by improving our systems. People's wellness programs for themselves or groups are good, but don't have a major effect on burnout. They're health inducing and mental health inducing, but not necessarily produce a reduction of burnout. But we now recognize moral injuries in our field. Took a long time. We've known about moral injuries since the late 1990s. A psychiatrist named Jonathan Shea figured that out from what happened to veterans in the Vietnam War. Nurses then, maybe a decade or two later, recognized that in their workplace. And finally, us physicians and psychiatrists recognize it. And the moral injury has to do with essentially our moral values being compromised one way or another, whether it's something we do that we feel guilty about, but especially when our leadership produces disappointment in what they do that affects our everyday work. But the kicker here is moral injuries are hard to recognize and accept because it tends to make us feel bad about ourselves. So, and that's different than burnout. And if moral injuries are associated with burnout, which I think is the case a lot of the times, it makes it harder to address it and recognize what needs to be done. With moral injuries, the treatment or interventions are still a work in progress. It's best to talk to trusted people, whether that's colleagues or religious leaders that you might be associated with, to discuss that. But we don't have any clear-cut interventions, although it got into DSM and ICD-11 as an item to be concerned about with healthcare. So what can we do during these holiday times is to think about, number one, is there anything that we can understand about our workplace that's making us feel less competent, that maybe isn't our fault, but also look for ways that we can try to make our workplaces better in any way possible, and especially consider whether we feel we have any degree of moral distress or moral injuries, because those seem to be quite powerful psychologically. So I think if we do that, we can also make holidays like July 4th have there some therapeutic possibility, which would be an extra bonus, wouldn't it? Again, it seems like we, as a field of psychiatry, haven't paid much attention to its meaning and importance. So the opportunity to do so is really helpful. And I hope it'll elicit some discussion in various places, whether that's in the APA caucuses or people's response to this video, whatever it may be. I think we need more discussion about how important it is and what we as psychiatrists can achieve positively out of this special, very special holiday. um, because changes are going to be increasingly rapid now, and we need to prepare ourselves and try to make the best of them for ourselves, for the public, and for patients.